Health Secretary Matt Hancock joins us now. Good morning to you.
Good morning. How are you?
Very well indeed. I wore my face mask in the cab this morning, wore it in the lift at work, not wearing it right now. As of the next Friday next week, it's going to be compulsory for me to wear it in a shop, but not in a workplace where I sit with people all day right next to them. 2 metres away, but certainly closer than I do with
2
people
metres
on
apart. I'm
two
glad
meters,
to hear
2
it,
metres
Julia.
apart. No, it's all very well done in the talkRADIO office.
Yeah.
But
Yeah.
I can sit closer to someone on the train, but just
Yeah.
for a couple of minutes, and I have to wear a face mask. What's the sense about that? Why have you come to that reasoning?
That's exactly the reason behind the rules as they are. And that's because a face mask can protect others if you are transmitting the virus, if you're with them for a short period of time. But if you're with somebody in the same room for a long time, then a face mask won't make a significant difference. What you need is the social distancing, the 2 meters or the 1 meters with mitigations, like in some cases a perspex screen or other mitigations. If for instance, another example is a teacher in a school. If you're in a classroom with kids for all day, a face mask wouldn't make any difference. But where it does make a difference is when you're in contact with somebody for a short period of time, for instance, in a shop, on public transport, because there you're coming into contact with lots of different people, and for a relatively short period of time. So that's why that's where a face mask works, and that's why the rules are as they are.
Okay, well, you did say yesterday, you said that people working in shops, shop assistants, they actually had one of the highest rates of coronavirus, and this was bound down to it. It does go against some of the advice and medical evidence we've been given previously. Are you planning to enforce it in anywhere else other than shops? So people have been asking, I know, about workplaces this morning. We've been told it's not going to be compulsory in this country previously. Is this likely to move from public transport to shops and then on to other workplaces or other places we visit regularly?
Not in offices, no. And the reason for that is that we have the rules in place for how offices operate, and the COVID secure guidelines, and as I set out the science. Of course, now the science is always being updated, and we're constantly learning about the virus. I mean, that's one of the issues of that about tackling this virus, is that we knew nothing about it 6 months ago, and now we know a lot more. So, of course, we update the policy when the science learns more, but we're not proposing to do this in offices for the reason that I said.
Right. Well, we know that according to Snap polls, the majority of people are in favour of this, but they may not necessarily be in favour of the policy being compulsory. If you give people the evidence, you tell people why it's necessary and why this is about looking after other people, not just your own health. It's about being a good citizen. Why does it have to be compulsory?
Well, we did bring this in as a recommendation at the same time that we made it compulsory on public transport, and we've just seen a much higher rate of people following the rules on public transport. The truth is that we've seen throughout this lockdown, the British people are a very law-abiding lot, and when we bring in a rule on something that makes it mandatory, the vast majority of people immediately follow suit. And that's good. It means that we can have very light touch enforcement, and it means that we can make these sorts of changes confident in the knowledge that people will get on with it. And so we did bring it in as a recommendation, but unlike public transport, people weren't really following it, so we've decided to make it mandatory.
Okay, well, I mean, you say light touch enforcement, but who is going to enforce this? I mean, I travel on the train. There's at least one person in my carriage every single day, normally a young man, refusing to wear a mask. I don't know, maybe they're all asthmatic and have anxiety issues. I don't know, but we are going to be seeing some scenes in shops, news agents, big supermarkets and the like, where you've got security guards having to face off with customers who are refusing to wear these masks. A lot of people will say, well, I've got a health reason, mental or physical, why I don't need to. Do we not need some way of identifying people who are not required to wear the face mask?
Yes, I've heard that idea, and we're not proposing to bring that in from the government, but I have seen a number of innovative, sort of thoughtful ways that people can demonstrate if they have an exemption from this policy, because there are important exemptions, exactly as you say, Julia, and also children under the age of 11. So there's people will have reasons not to. And it's important. Those reasons are important. It's important that we respect that. But as you say, I mean, you were talking about your tube carriage with one person. The vast majority of people are following the guidelines.
But people do get resentful, don't they? If they're following the guideline and sitting in a hot, uncomfortable mask or shopping in a hot, uncomfortable mask, they're going to be a bit annoyed that someone else isn't wearing one, but is reaping all the benefits of everyone else being a good citizen.
Well, that's right. But this making something a social norm, making this the way that people operate is a part of how we've responded as a community to the virus, isn't it? I mean, that was true in lockdown when, if you walk too close to somebody on the pavement, you got a bit of a stern look, which is a very British way of expressing your displeasure.
It's pretty much how we express all of our emotions, a stern look on the pavement.
It makes me quiver.
Let's talk about the very stern possibility of a second wave. Now, I understood talking to people in government in the recent months, there was actually not much concern about a second wave. The belief that actually Britain, although we'd had a very high death toll early on, that we were not going to be looking at a second wave. We've not seen second waves in many of the other countries around Europe that have come out of lockdown much sooner than us. But now there does seem to be serious concern that we could this winter face a double whammy. Maybe if it's a cold winter, a bad flu season, coronavirus hits again, things can get very difficult again. Can you guarantee to my listeners that we will not go into another full lockdown, whatever happens?
Well, I'm not going to make that's any guarantee. After the 6 months I've had, you'll understand why.
The Prime Minister said a few weeks ago there would not be a second lockdown.
Well, the thing is that in healthcare, I as Health Secretary never use the word guarantee because it is it's a risk-based business. So it's just a principle I have of doing my job. I'm asked to, I'm asked to guarantee lots of things, and it's but being Health Secretary, you do come across some unexpected risks coming through. So but the point is that we don't want to see a second wave, and we will tackle it. We'll tackle the problems that lead to a second wave if we see them. For instance, through the local lockdowns that we're seeing, Leicester a couple of weeks ago, and then this morning action being taken by local councils to tackle.
You're saying we've got the testing and tracing capacity up and running to prevent a second wave, and have we got the PPE available for care homes and NHS?
Yes.
We were told that. I mean, we had quite a few months to prepare, and we didn't have it last time round. But are we going to have it this time round if we did have one?
We're rebuilding that stockpile right now.
When you say we are rebuilding that right now, okay, so it's the 15th of July. By what date will we have enough PPE that we know we can get through a second wave if we have one? Because if there is a second wave, it's going to be around the world, isn't it? In which case, it's going to be the same pressures that we faced in February, March and April in stocking up on PPE. Should we not be just buying up every bit of PPE we can right now? It's a lot of money, but you know what? It'll last a few years. It's not going to hurt us to have it.
Yes, that's exactly what we're doing. And if you think about it, PPE is currently being used right across the NHS and social care. The challenge last time was that suddenly people went from previous business as usual to using PPE all of the time. We're now in the position of using PPE all of the time. And so winter is always harder for the NHS. It's always harder for people's health because it's colder. And that's true, COVID or no COVID.
Okay, yeah.
And and so we are building those PPE stockpiles. I haven't given you a date because it's kind of we are building the stockpiles to have the PPE that we need. There's no data attached to that.
We're going to hold you to this one, Secretary of State. Let's also talk about. I mean, I want to go on to Huawei just briefly after this, but we know with the concerns about a second wave that we've still got those Nightingale hospitals. They're all mothballed, sitting there waiting to go. Why can we not, given that we've got that capacity built up, are you able to get enough ventilators, get the stuff back in, why can we not return largely our NHS hospitals back to doing routine surgery, routine treatments, and stop having 10 million people who are set to be on the waiting list? Why can we not make sure that people are getting cancer referrals, being treated for heart disease, getting all the treatments they need right now? Can we not now actually say coronavirus patients will go to specialist hospitals and the rest of the NHS is going to carry on as it would normally?
Yes, that's exactly where we're going.
How soon?
Well, that is being put in place as we speak. There's just one thing I wanted to explain, which is slightly different to how you asked it, which is in some places you can make a whole hospital, a coronavirus hospital, and another hospital completely free of it. In other areas, like especially in rural areas, you can't do that because there's only one hospital serving that community, and so you need to split the hospital itself into what are called green and blue areas. But we are in the process of splitting the NHS into COVID and non-COVID areas for exactly the reason that you set out, and ramping up the number of other non-COVID treatments, which of course are so important.
Okay, and also let's talk about Huawei. Obviously, a big political decision announced yesterday by your colleague, the Culture Secretary. Donald Trump overnight has claimed credit for the decision to U-turn on having Huawei's involvement in the 5G network. Was it down to Donald Trump?
This is a technical decision. It was based on advice from the National Cyber Security Centre. And I thought that the Culture Secretary set it out very well in the Commons yesterday.
This is simply a matter of Britain acting in its own best interest, nothing to do with a bit of arm twisting by the Donald.
Well, it's a technical decision. I mean, the advice from the National Cyber Security Centre is about how you can build a safe and secure, high quality 5G network that's going to help us with our mobile phone signal for many years to come.
Well, we know, of course, that broadband, mobile phone signal, this is going to be crucial, 5G, to the reopening of the economy, the build the Prime Minister talked about. He's going to talk more on Friday about getting the country back to work and building ahead of the future and moving out of this lockdown and getting people just back in their offices. And we saw that economic news yesterday, pretty dire news about no V-shaped recovery being on the cards just yet. How concerned are you about the economic repercussions and the health fallout from that?
Oh, it's serious. The economic repercussions are serious, Julia. And, this is, it's a very difficult problem. And we've got to keep the virus down so that the economy can recover. We talked on this program a couple of months ago about how there isn't a trade-off between the economy and health, because what you need to do is get the virus right down and then you can reopen the economy. And that's exactly what we've been able to do. And that plan is working, but we've got to get it right under control.